I'm Dr. Sam Marzouk, clinical child psychologist and founder of Promethean Psychology. If you're a parent of an anxious child and struggling to figure out how you can best help them, my Anxiety Busters video course could give you that roadmap that you've been trying so hard to find. And that's really what this video course is all about. It's more or less a roadmap for you, packed with simple, comprehensive, and research-supported strategies for helping your anxious child. So to help you make the decision whether this course is right for you, I'm going to tell you a bit about me, what's actually in this course, and a few tips to help you decide if this video course is going to be helpful for your personal situation. Okay, so a bit about me. As I mentioned, I'm Dr. Sam Marzouk, and I'm a clinical child and adolescent psychologist. So this means that I specialize specifically in assessing and treating childhood mental health concerns. I think you also should know that I'm a total science geek. Now, I include that because I think it's important that you know the content in this course, it doesn't come from my own personal set of opinions or personal experience. The content comes from years and years of research on what anxious children really need to get better. Now, I'm going to include some of my personal opinions and experiences, but only as a way to illustrate what the actual science tells us. So what's actually in this so-called roadmap? Well, let's take a look here. All right, so I'm going to start off by actually having you forget everything you know about anxiety and discussing what it really is, because there's a big misconception out there on what anxiety is and what it's not. Next, I'm going to go over how parents have to show up when responding to their child's anxiety. Before we get to what to do, we have to know who to be. After that, we'll get right into what to do. We'll start by talking about exposure and how it just may be the key to your child overcoming anxiety. Next, I'm going to carefully explain what this thing called accommodation is, why almost 100% of parents do this, why it's not helpful, and how to change it. After that, we'll get into how to deal effectively with your child's anxious thoughts and worries. Anxious thoughts and worries are a big part of child anxiety, and many children feel as though they can't be changed. So I'm going to teach you how to show your child that they indeed can be changed. Following that, I'm going to talk about Roosevelt's famous quote, "The only thing we have to fear is fear itself." I'm going to explain why that's actually not helpful at all for anxious children, and I'll describe what is helpful. And finally, I'm going to wrap things up with 3 final points that tie everything together. Okay, so you're here to make a decision as to whether this video course will actually help you. And I'll be the first to admit, it's not for everyone. So who is this course for? Well, if your child is between the ages of 3 and 12, it's probably going to be most helpful. Now, if your child is outside that range, there might be some useful tidbits in here, but probably not worth your time and money. If you're convinced that the primary concern for your child is anxiety, then this is likely the right course for you. But if you're not sure whether your child has anxiety, depression, or something else, I strongly recommend first talking to a licensed mental health professional to try to get that figured out. And finally, remember that this is a course for parents. It's not for children. So if you are looking for ways to help your child at home with their anxiety, this is probably the right course for you. Now, and most importantly, before you decide to purchase this course, it's important to understand that this video course is not intended to be therapy. The purpose of this video course is to provide education and information to parents and caregivers of children with anxiety. Now, every child is unique and has very different needs. Please see a licensed mental health professional for a more specific approach for your child.